Hi, my name is Kirsten Cummings and I am with the Cascade FFA chapter. Today I will be talking to you about sheep dystocia. The sheep industry is a big one and growing even as we speak. Whether it is the club lamb or commercial sheep operation, there are still problems that arise. A specific and widespread problem in this species is dystocia, or difficult birth. This is a major concern for sheep producers because it is the leading cause of lamb mortality and can also lower fertility rates for ewes who experience it. The most important factor in determining profitability of a sheep enterprise is production rate. Productivity of the ewe flock is a direct reflection of reproductive efficiency.
Thank you.
It is important to recognize when the ewe is delivering with normal presentation of lambs, or to recognize the multiple types of dystocia that may occur, and to be prepared for how to act in each situation in an effort to ensure flock productivity. As lambing time approaches, there are a few key behavioral changes to look for. First, ewes will engage in nesting, separating themselves from the flock, grinding their teeth, straining, or just acting nervous and uncomfortable. Once these behavioral changes begin, a producer will have approximately between 2 to 15 hours before the impending birth occurs. The birthing process is described in 3 stages. Stage 1 includes uneasiness, kicking, clawing at the ground, lying down, and getting up frequently. Early signs of labor can either be visible or non-visible, meaning that they may or may not be physically seen. Stage 1 usually lasts between 1 to 8 hours and ends with the introduction of fetal parts into the birth canal. Stage 2 is where the visible signs of birth begin. First, there will be the appearance of the water sac or the evidence of a foot or leg in the birth canal. This stage will typically last between 1 to 2 hours or 15 to 30 minutes per lamb. Stage 2 will end with the birth of the lamb. In stage 3, the placenta will be passed approximately 20 minutes after the birth of the lambs. Afterwards, some ewes may consume the placenta, which is rich in the hormone oxytocin and aids in milk letdown. It is best to leave ewes alone unless a problem occurs. The majority of ewes and does give birth with no problems. However, even in the best managed herds, a subset will have difficulty. If there is not significant progress in 40 to 60 minutes after the water sac appears, then there might be a problem. If a problem erupts, these are the steps to follow in order to act. First, wash your hands and use protective sleeves or gloves to minimize the introduction of infections. In addition, be sure to choose lubricant that also doubles as an antiseptic. It is also important to remember to be patient because rushing the job can lead to further complications. Another great step is to have an imagination to be sure that you are able to visualize lamb body parts and the different positions that they may be in by merely touching and feeling the lambs of the inside of the ewe. Determine the position of the fetus before making a decision to pull a lamb or kid. The person assisting should gently insert their hand inside the ewe or doe and feel the lamb or kid in order to determine its position. As previously stated, the definition of dystocia is difficult lambing. Being able to recognize a ewe having difficult lambing is key. There are many common mistakes made by inexperienced producers or shepherds. That being allowing mothers to be in labor for too long before giving assistance can be fatal. To prevent this, check the progress of ewes often. Intervene if no progress is being made within the crucial hours of birthing. Trying to intervene and deliver a lamb without correctly identifying and fixing the problem first is another common mistake. Some causes of dystocia can include extra large lambs, twins being presented at the same time, the size of the ewe's pelvis and birth canal, as well as the ewe's failure to dilate prior to birthing. If lambing occurs with normal presentation prior to birthing, if lambing doesn't occur with normal presentation, there are multiple reasons that a lamb positions that will also need to be checked for. A few of these abnormal presentations are a lamb with elbows locked, head turned back, breacher backwards, twins or multiples with front and back legs intertwined, and twins or multiples with 4 legs and only 1 head showing. It is very rare that a shepherd will need to intervene when a lamb is in normal presentation, with 2 legs and the mouth showing. Occasionally it will be necessary to apply a firm, steady grip and gently pull the lamb. When the elbows of the lamb are locked and held downward, it is necessary to push the head back into the womb and continue by the pulling of the legs forward one at a time, and then assist by pulling out the rest of the lamb. When assisting a lamb with 1 leg back, the shepherd can simply reach in and slide their hand along the shoulder of the lamb to locate the foot or the leg that's turned back, and keep their hand on the hook to protect the wall of the birth canal. Next, gently move the leg forward to the normal position and pull the lamb out. In the chance that a lamb is presented with the head turned backward, the first step is to push the lamb back into the uterus. and then manipulate and turn the head into the proper position and pull the lamb forward until it can be delivered. In the instance that a lamb is presented breech or backwards, it is important to act quickly. Once the pelvis is delivered, the rest of the lamb can be pulled in a downward direction. Be sure not to do this too early to avoid getting the lamb stuck in the birth canal. Multiple births are not uncommon in the sheep industry. When delivering twins with presentation of one set of front legs and one set of back legs, it's important to stay calm. Before making any sudden moves, make sure to go in and check and figure out what is coming out first. As long as there are two back legs that belong to the same lamb, or two front legs and a head, then it's time to start working. If they are tangled, use your imagination to untangle them, and proceed as necessary one at a time. When twins are presented with four legs and only one head, it can be quite a sticky situation. Oftentimes, this may take a while to figure out, but patience is key. If they are both coming out, gently push lambs back to allow enough space to deliver one lamb at a time. Before making sure both legs apply to the same head of the same lamb. Once the first lamb is delivered, gently slide the head of the second lamb into the position and gently pull out. Once a lamb is born, it's important to do some follow-up on mom and baby, or aftercare. First, always make sure the lambs are breathing and their airways are clear. Then make sure that the ewe is up and cleaning off her lamb. It is also important to open the ewe's milk duct so the newborn lambs can consume the milk, which is rich in colostrum. Lastly, if any further bleeding occurs, it might be in your best interest to consult your veterinarian. Also, be sure to check the ewe has passed or after birth once done lambing. To recap, while there are many things that we can't do to fix the problem of dystocia, there are many things we can do to help eliminate the percentage of lamb mortality during labor. Today I have discussed several different ways a lamb can be born, as well as normal presentation. I have also shared keys to successful lambing, supplies, the stages of active labor, causes, aftercare, and common mistakes. As you can see, it is important to recognize a ewe is delivering with normal presentation of lambs, or to recognize the multiple types of dystocia that may occur, and to be prepared for how to act in each situation in an effort to ensure your flawed productivity. Thank you.